years ago, I certainly understood the importance of this office to influence public policy, programs, and services. I did not assume to know what seniors in this province needed, nor their solutions, but I felt responsible to ensure accurate and strong, fair representation for them. So, to accomplish my role, I knew I had to hear from seniors. I wasn't sure how I would be received. Did seniors even feel they needed an advocate? The answer is an overwhelming yes. How do I know this? Because an unprecedented 1,300 seniors in this province took action to ensure I heard their voice. So I would elevate the collective voice of seniors in this province and press forward for solutions to meet their needs. I thank the seniors of this province for sharing their lived experiences with me, their needs, and their wisdom for practical solutions. Thanks is also extended to the many community organizations that partnered with my office to support this process, and to MQO Research for their statistical and technical support. So today I'm sharing with you the voice of seniors in this province through the release of a report titled What We Heard: Engagement with Seniors, Family Members and/or Caregivers, and Service Providers. This What We Heard report is based on a consultation process which included a public survey available online and on paper, and 15 in-person public engagement sessions throughout the province and 2 online public engagement sessions. I am delighted to say that in total 1,087 surveys were completed, 913 of which were from seniors, and approximately 390 seniors attended the engagement sessions, many of them in the winter that they had to come out in. With over 120,000 seniors aged 65 plus in this province, the 913 completed surveys from seniors represents a strong sample with a margin of error of plus or minus 2.3% at the 95th confidence interval. So what does that mean? It means because the sample size is so large, exceeding typical industry standards, it is a fairly solid representation of seniors in this province. What a success. So, what did we hear? Seniors in this province are struggling, not just with accessing health care, but also financially. In fact, seniors identified healthcare and cost of living equally as their top priority areas needing improvement. 32% of seniors that responded to the survey did not feel they had enough income to meet their needs. And 1 in 7 said they knew a senior that didn't have enough income to meet their needs. When you consider that only 14% of the respondents to the survey received the guaranteed income supplement, which is the lowest income seniors in the province, this means there's a group of seniors with income above the GIS that are financially struggling and can't afford what they need to live. This finding completely debunks the myth that if you reach age 65 and you access your federal and provincial benefits, you'll financially be okay. It's just not true. Specifically, as it relates to cost of living, for the 1/3 of seniors, the 32% who reported they did not have enough income, and the 71% of seniors who said they knew a senior who didn't, the main reasons given were the increased cost of living, insufficient provincial and federal benefits, and even insufficient personal pension income. 40% of these seniors reported not being able to afford food nor to eat healthy due to inadequate income. 60% said they went without food. 60% of these seniors said they did not attend social events. This is concerning, as we know seniors having access to adequate and quality food is imperative to their health. Seniors remaining connected with social events and in their communities is vital to their mental well-being and quality of life. I wish to specifically note that during our public consultations, we met with several groups of seniors in very low income. The concerns raised by these individuals were distinct and profound, and you'll notice that their concerns are highlighted throughout the report. I certainly appreciated them sharing their real-life experience with me. Cost of living, especially for food, and safe, affordable, accessible housing were major worries for these individuals. Concerns for their personal safety against theft and break-ins, and poor living conditions, including mold and rodents, in some of the low-cost rental housing were a real reality for them. In terms of healthcare, access to primary healthcare professionals and long wait times were the most identified unmet need. These concerns included insufficient walk-in coverage in clinics and limitations on the number of health concerns you can raise to your family physician. Many seniors brought up scope of practice of health professionals and suggested allowing other non-physician healthcare professionals, such as pharmacists and nurse practitioners, to complete some of these tasks, but with the understanding they could bill MCP, as seniors are currently paying, in some cases, out of pocket. Not surprisingly, healthcare and personal care homes were of major concern to seniors, and adequate staffing levels was the top suggestion for improvement along all the surveyed participants, except for Labrador, where their priority was really based on more facilities and more spaces. During the public engagement sessions, participants voiced concerns around access and affordability to personal care homes, with protection from rent increases really needed. Waitlists for long-term care, first available bed policy, separating couples, and insufficient training for staff is impacting the quality of care for seniors in these facilities. Another area of healthcare identified as needing improvement is home support, with adequate staffing levels as the top mention and better training for staff. When it comes to support for people living with dementia, financial aid for caregivers was the top mention for seniors, with training and education for caregivers, family members, and the general public being second. However, when looking at the data regionally, improved and more facilities was the top mention for Labrador. Other identified areas of need were housing and transportation. 84% of seniors want to remain in their own homes as they age, but identified they needed assistance with home repairs and household maintenance. And their family members or caregivers noted they needed home support. 23% of seniors said they were looking for something different than living at home. They wanted an apartment or a condo. 21% said a seniors or retirement community complex. All noted these were not available or affordable and had long wait lists. The fear that the rent in these will continue to increase is also of significant concern. Looking at transportation, 96% of seniors said they have access to transportation, with 89% owning and driving their own vehicle. Rural seniors noted access to transportation is more of a concern, especially with having to access medical services, which are getting farther and farther away sometimes from their communities. While health concerns and cost of living were identified as the priority areas for improving the lives of seniors, when asked to rank a list of items in priority, the number one response was supporting seniors with the goal of aging well in their own homes, which I think is telling as it relates to really what seniors want in this province and what they feel they need to reside at home. Of course, we all know that healthcare and financial security are tied to the ability to age well in one's home. So where do we go from here? My office has already taken steps towards addressing some of these concerns, and we've seen some positive results as a consequence in the budget process. Moving forward, the findings of this report will be used to help guide my office's actions and strategic direction as we work toward improved services for seniors in this province. Guided by the data in this report and the prioritization that seniors placed on their concerns throughout the engagement process, my office will analyze all of this valuable information, collaborate, and conduct research to inform any necessary recommendations for improvements to senior services. In closing, I am releasing the What We Heard report publicly today to inform all stakeholders on what 47.1% of this province have collectively identified as their needs and their priorities. It is intended to inform policy development, program delivery, and spending at all levels of government. It may better inform service providers and businesses in their work to meet the needs of their clients, who the majority of are seniors, and of course, to give a collective voice to the seniors of this province. Thank you very much, and I'll certainly take questions. If we could just